Morning, how are you? It's a lovely day here. I had a great weekend. I hope you had a great weekend too, wherever you were in New Zealand. On Friday last week, I went up and spoke at a conference of an aligned service to, the care of older people. So that's across the spectrum of, right? So this group of individuals deliver services to older people wherever they are, whether they are in home care or whether they're being in residential care or whether they're in hospital. They specialise in the care of older people. And inside, when we were having a question and answer session, there was a statement made that sort of led to a question, but really it was about making a statement. And it's a statement I've heard before. It's a statement I've read before. And it was a statement that said, this individual works in the community. So she was talking about residential care facilities and how sometimes when she goes and visits some of the seniors that are there, they tell her that it can take minutes for somebody to come and help them to the toilet when they need to go to the toilet. And she repeated something that I'd heard previously and I'd also read previously, is that that she was also being told by residents that they were instructed to use the incontinence pads that they were wearing because that's what they were for, rather than be taken to the toilet because the staff didn't have time. I want to read you something, right? I just want to read you this article. So it says, too often patients will wait more than 10 minutes to get off the toilet because I'm too busy to help them. Too often their medications are delayed because I have been too busy. Too often their dressings are delayed because they are time consuming, and time is something we are always short of. Now, do you think that that is a statement inside an article about a residential care nurse or healthcare worker, or do you think that's somebody inside of a hospital? And then when we go further down, this phrase, this sentence, and this is all on a day when we only have 5 patients. Sometimes we have 6. That leaves us just 1 hour and 20 minutes per patient, which, when you think about all the tasks I've just mentioned, is clearly not enough. Okay, so that is by a nurse inside a hospital where they have 5 to 6 patients a day. The circumstances that this other individual was talking about is around nurses or healthcare workers inside a care facility that may have up to 30 individuals that are there or more, right? And of course there are staffing levels that are, there are safe staffing levels that are ratioed out for people's time. But I guess where I'm going in my head is, what is an appropriate number of minutes by which a person needs to wait until they can be taken to the toilet? And my second sort of question is, why is the assumption that the statement with regard to using the incontinence pad is said nastily? Because that's always the underlying suggestion. The underlying suggestion is that the individual has been dismissed and told just to use the incontinence pads, as opposed to the nurse or the healthcare professional saying, darling, if I can't get to you, it's okay to use the incontinence pad. That's what they're for. So if for some reason I can't get here in the time that you need me to be, it's okay to use the incontinence pad. So why is the assumption that all of these things are done because somebody's being mean to the older person? And I don't know, personally, look, I recognize that I could be one of those people that could be sitting there and pushing a button because I need to go to the toilet and I need somebody to help me, to take me to the toilet. But unless there is somebody right there dedicated 100% to me every minute of the day, there will be a delay. And it may be that another person is in the middle of being taken to the toilet. And so there will be a delay for me to be able to access another human being. That's the world, I would have thought. That's life. Now, if we are unhappy with that, when I say we as a country, then what is the appropriate amount of time? Because it's not just in residential care, it's not just in our hospitals, and at home there are people I know have had loved ones who, because they have difficulty getting to the toilet on time, they also wear continence pads. So it was just a really interesting interaction, and the suggestion was that it was done with malice and it was done because people don't care. And I think that's the last thing that I thought was really interesting. What is it that they're talking about? It's that this person, we nurses are the ones that have to field complaints from patients and their families about how they haven't been showered or waited too long on the toilet. Not the government, not the Minister of Health, and not the Prime Minister. And that's the same for nurses and healthcare assistants in hospitals, in residential care, and anywhere else. So I was a bit saddened that this was another health professional that got a tone as if these individuals, the nurses and the healthcare assistants, aren't working hard enough. They are. And sure, we're all on the same page. We need more supports here. But let's also keep that realistic view, right? That we cannot have a one-on-one strap a person to another person outcome so that in the moment that they need somebody, that there will be somebody there in that exact moment. That's not how the world's going to work ever. And it doesn't now, even when, you're fit and healthy. There's nobody there standing there right then just in case you might need something. So if we don't join together as professionals and create solutions rather than picking on each other, then we're not going to get very far forward. Bye.